I'm Dr. Mahantesh Magadum, a specialist orthopedic surgeon working in Saudi German Hospital. I'm exclusively practicing hip and knee and shoulder surgeries. Today, I want to discuss about one of the very common conditions in the shoulder joints and diseases, that is frozen shoulder. Frozen shoulder, it's a common layman word, but the medical terminology for this disease is adhesive capsulitis of the shoulder joint. What exactly happens in this frozen shoulder? Because it's a very common problem, most of the women suffer from this disease, that is from the age group of 40 years, anywhere between 80 years. Most of the time, this cause is not very much known about frozen shoulder, but it is also associated with post-traumatic injuries. Once the patient suffers from a fracture, after the treatment is done, they might suffer from frozen shoulder. Even after some surgeries of the shoulder, where when the physiotherapy rehabilitation process is not undertaken properly by the patient, they might suffer from frozen shoulder. But today, I want to exactly discuss what goes wrong with frozen shoulder, because it's a common condition and most of the patients are unaware of the process or a pathology of this frozen shoulder. It's actually a self-limiting disease, but it goes in stages. The first stage is a painful stage wherein patients' daily activities are disturbed and the pain is more in the night. The second stage is the shoulder joint becomes very stiff. The third stage is thawing stage. The movements starts improving. So in most of the stages, in other words, in all the stages, the patient should seek a treatment from an orthopedic specialist or a shoulder surgeon so that we can guide these patients properly for further treatment. Most of these cases are treated conservatively, that is non-operatively. The non-operative management includes medications and extended, prolonged physiotherapy treatment. Physiotherapy treatment plays a very important role. The exact pathology of this disease is the capsule gets adhered to the joint. The capsule, in the sense, the ligament and the capsule, all the structures become very much adherent to the joint, which prevents the movements of the shoulder joint. So, the role of physiotherapy is to mobilize the shoulder joint so that the patient achieves full range of movements in a due course. Most of these patients are also treated by analgesics, and that's anti-inflammatory medications, and followed by rehabilitation process. At the same time, there are some patients who do not respond to the usual analgesic treatment and physiotherapy treatment. Even after prolonged physiotherapy treatment, they do not respond. These patients are called resistant frozen shoulder patients. Such patients, we do a minimally invasive surgery called arthroscopic release of the capsule, and even for few patients, we also do a forceful manipulation of the joint under anesthesia, which is a very fantastic treatment to get back their full range of movements of the shoulder joints.
Saudi German Hospital, caring like family.